For Action News, I'm Anna Samovska. And wrapping up 2013, the FDA approved 27 new drugs to hit the market, some for lung conditions, depression, and to treat cancer. But that's still 10 fewer drugs to hit the market than in 2012. But who's counting? And why should we? ACTRA's Dr. Josh Bloom says the real issue is not the number of new drugs approved, but the lack of antibiotics to treat resistance.
The portfolio of drugs is similar to last year, and that is dominated by cancer drugs. And that we seem to be getting more and more cancer drugs.
But Dr. Josh Bloom says the real problem lies in antibiotic resistance and the lack of effective antibiotics on the market, with the U.S. and other countries seeing a rise in resistance and a rise in mortality rates from routine procedures.
There have been 3 stories about the antibiotic emergency in the last week or so. The first comes from Great Britain, where they're talking about the tipping point at which we will no longer have antibiotics to treat routine infections. And it's been suggested that the antibiotic problem be placed on the National Risk Registry. Just for comparison's sake, another item on the register is terrorism. So basically they're saying that this is as much of a threat to the country as terrorism. I would argue it's much more of a threat.
Last year, there were nearly 100,000 deaths in the U.S. from antibiotic resistance. That's more than breast cancer and prostate cancer put together. Perhaps the deadliest infection plaguing U.S. hospitals is CRE. In 2001, the infection was reported in 1 U.S. state. Today, it's affecting 46, and 50% of patients who come down with the infection die as a result.
This is the most acutely dangerous infection that we're facing now. But another one will pop up in a year or two. It's inevitable. The consequences of this are obvious. Maybe you can slow it down, but it can't be stopped. You're going to see more and more previously treatable infections that are no longer treatable. The FDA has finally realized that they screwed up 20 years ago by making clinical trials impossible for antibiotics. Now they're loosening them, going all in the other direction. That's great, except almost all the major drug companies got out of antibiotic research in the mid-90s when the FDA instituted this policy. So now they're relaxing it. We've lost 20 years of research, and the antibiotic portfolio or pipeline is pathetic. So even if you started today and the FDA did everything possible to approve antibiotics, it's going to be 10 years or so until you really see anything that will be effective against these resistant organisms.
And to read more on this story, head to our website, action.org. While you're there, don't forget to also sign up for your daily dose of news delivered right to your inbox. For Action, I'm Anna Samovska.